Kitty Williams, and I'm here to give a persuasive speech about making informed healthcare decisions. And also this speech will meet requirements for my Communication 110 class, section IX1 at Southeastern Community College with Professor Alatorre. I would like for you to think about what would happen to you if something happened to you today that left you where you couldn't make any decisions for yourself. And who would make those decisions for you? It is so important to make these decisions while you can. So while you're thinking about that, I'd like to tell you a little story. I had a patient very recently for open heart surgery. Before that, he'd been out walking in a field with his wife. As they're walking along, and I'll tell you this man's early 40s and never had any health problems that he knew of ever. They're walking along. She says he reached over and he said, "Honey, my back hurts." And then he started to talk about his chest. Before he could finish his sentence, he had collapsed on the ground and he was completely unresponsive. But he's a very lucky man. His wife had a cell phone that worked. She called 911. She got emergency help and she started CPR. But the other side of the story is, after this event that he survived, it took over 2 weeks for them to be able to find any brain activity on this man. It took another month after that before he could even make simple sentences. It took another 2 weeks after that before he was strong enough for the doctors to suggest that he have open heart surgery to treat his coronary artery disease. Through all this time, the family went through a lot of turmoil. The wife thought that he would want his parents to make the decisions for him. His parents thought he would want his wife to make the decisions. But even then, as they talked, nobody knew what he would want done. While he went through this period of no brain activity, nobody knew. And they could have really not had all this trouble if they had just all made a living will while you're still healthy and you're able to make decisions. There's a really neat pamphlet out that's called 5 Wishes, and our chaplain service at our hospital uses it. You can get it at Mission Hospital in Asheville, North Carolina. You can get it in the Blue Ridge Hospital or the McDowell Hospital, and these are all Western North Carolina hospitals. If you're not in Western North Carolina, you can go online to www.agingwithdignity.org and order it there. It's published in 26 different languages. They say over 8 million people have used this document now, and it was formed by a man who worked with Mother Teresa in D.C., and he worked for the last year that he worked with her, he was in a hospice, and he wanted to create an instrument that helped patients and families make decisions together. It's legal in 40 states and in the District of Columbia. In North Carolina, you have to have a notary. It's one of the 4 states that you do have to have a notary. In any of the states, you have to have 2 witnesses. The 5 wishes that it covers are, who would I want to make my health care decisions for me if I can't? The second one is, what type of medical treatment would I want to have or not? The third one is, how comfortable would I want to be? And that is talking about how pain-free do you want to be. And the more pain-free you are, the less responsive to your family you might be during that time. So you want to decide that ahead of time. The fourth one is, how do I want people to treat me? Do I want them to not talk about it? Do I want them to talk about it? And then the last is what would I want my loved ones to know that I can't tell them? That I would want forgiveness for anything I ever did that ever hurt them. That I want the happy times to be remembered, things like that. So if you can't do a living will for yourself, do it for your family. My patient's family went through a very, very hard time. It's very hard to have a family member have an unexpected thing happen. We all know it's even hard when it's expected, but when it's unexpected, it's very, very hard. And then for no one to know what that person's wishes were or who they would have wanted them to carry them out, it just makes it a lot harder. So please, please, please think about thinking about these things and make decisions for yourself and let someone know. And make sure it's someone that agrees that they can do this and that they're strong enough to stand up for you and make sure that your wishes are carried out. Thank you.